The plantar fascia is a really strong ligament that runs on the bottom of your foot. It is the main static support of your arch. So basically, it is helping to maintain your arch. It is seeing stress as you're walking. Another function of it is that it essentially helps with gait through something called the windlass mechanism. But it's something that sees stress each and every day, but it's a very important ligament for maintaining kind of the strength and position of our arch in our foot. So the way I see people most often describe plantar fasciitis is usually a sharp stabbing pain that they feel most often in the bottom and inside part of their arch, actually around where their heel pad is. Sometimes I'll see this more atypical version of this where it's more centrally in the arch, kind of along the inside part. But most often it's described as having this sharp stabbing pain with the first step after resting. So people will typically describe first step out of bed in the morning or first step after a long car ride. Generally, people will hobble around for a little bit, and then after they kind of get going, this pain improves. The longer they're on it, sometimes this pain can kind of recur, and then the whole cycle kind of starts back over. But that's most often how this presents. So in my opinion, plantar fasciitis is a combination of, in the simplest way possible, overactivity, inappropriate shoe wear, and a tight calf muscle is kind of the main culprits in my eyes. Certainly different foot position and other conditions can play into this being tighter or being more painful, but overactivity, poor shoe wear, and a tight calf muscle are probably the main issues that I see it for. So the treatment for plantar fasciitis is largely conservative. So very, very rarely does it require surgical intervention. I think the other important thing to notice or at least be aware of is that some things can mimic plantar fasciitis. So something like a calcaneal stress fracture, which is a heel bone stress fracture, or tarsal tunnel syndrome, which is like carpal tunnel syndrome but of the foot. So they can kind of mimic that arch pain that you see with plantar fasciitis, but assuming that stuff's not what's going on, plantar fasciitis generally gets better with conservative management. Much to what a lot of people realize is that plantar fasciitis can take really several weeks to months to even completely improve, and that's with doing the right stuff. So I start very simple. Calf stretching, particularly what's called eccentric calf stretching, which is a slow and controlled stretch of the calf muscle, holding that deep stretch, and something else called plantar fascia specific massage. And I think that's a better version of rolling the arch on a frozen water bottle, which I think a lot of people come in and they've read that online or somebody's told them to do that. So I think it's a better way of working on the plantar fasciitis from there. There is appropriate shoe wear changes, good supportive arches. There's steroid injection into that area, but generally try to reserve those for when we really need it, because as you can imagine, it's not a particularly pleasant injection, but it can be very helpful when other stuff has failed. Anti-inflammatories, activity modification, things like that. And then again, there's other non-operative modalities that you can consider. PRP injections, which are platelet-rich plasma, and basically trying to induce healing in that area. And then similarly, shockwave therapy and formal physical therapy to maybe consider some dry needling or other anti-inflammatory modalities are all non-operative ways of kind of dealing with this. I think the time to see somebody about, or an orthopedic specialist about plantar fasciitis is really when, again, this becomes a daily issue for you. You've maybe tried some shoe wear changes, you've tried some over-the-counter anti-inflammatories, you've tried some of the different stretching and massage techniques, and you're just not making the progress that you need. So maybe you need a little bit of guidance as far as how often you should be doing these exercises, how to do them appropriately, which is a common thing. People come in, just have not been doing the stretches right. And generally, once we get that stuff align, people tend to get better from this. But I think when you've tried some of this more simple stuff and it's not making any big difference, I think that's when to seek further assistance.